Good morning, good afternoon, or good evening, and welcome back to Bariatrics and Beyond. We've been gone for a minute, but we're back. I'm back. I have recovered from my plastic surgery that I had, and during my recovery, I was thinking, what do the people wanna see? Who do the people wanna see on here? And a huge, huge, huge part of my plastic surgery recovery was a big thanks to the EOC nurses. So I wanted to introduce you guys to some of the nurses who will be at the Grand Hotel taking care of you. So today we have Tanya and Ricardo.
Hello.
Hi guys, all the way from Tijuana, Mexico. So do you guys want to introduce yourself to everyone? Let them know who you are and how old you are, where you came from, how long you've been working at EOC, all that fun stuff.
Yeah, sure. Well, I'm Tanya. I'm 29 years almost, and I have with EOC like 5 years, I believe. What else? I'm from Mexico, Sinaloa, and I have almost 9 years being a nurse right now, and that's it.
Yeah.
Amazing.
Hello, my name is Ricardo, and I have like around 8 years being a nurse and 4 years working here with DOC, taking care of all patients. And I'm from Tecate, the city beside Tijuana.
Awesome, awesome. So you guys are very popular on the EOC Facebook pages. All our nurses are, but especially you two get a lot of praise. Everybody just loves you two, and I know why. I love all you. I love all the nurses. All the EOC nurses are amazing. Um, you two in particular are definitely angels for sure. So now can you explain to the patient, so we have obviously weight loss surgery patients and plastic surgery patients, and you guys look after all of them once they're back at the hotel, and even pre-op as well, you guys do some stuff. So let's start with the bariatric patients that are watching. What do you guys do for them? Let's start from, let's say, when they arrive in Tijuana. What's the first step?
But the first step once the patient arrives here with us, you always have the first meeting with the guys on the front desk. And after that, we give all the patients the fasting time. A lot of time you just have all their liquids and everything for surgery. We also ask about medications, if they take medications, which medication they need to stop before surgery and everything. And I think that's all what we do before surgery.
Do you guys do the EKG there for the bariatric patients?
No, no,
Oh,
they do it up all at the hospital.
gotcha. So that's just for the plastic patients. See, you guys, I'm learning things all the time. Okay, so we'll get to the plastics patients in a minute. And then after, so the bariatric patients, they go to the hospital. They'll be there for 2 days. Their drains come out, all that sort of stuff. So once they get back, it's very not a lot happens really for them. It's just kind of recovering. But what do you guys look after for the bariatric patients once they get back to the hotel? What happens then?
Well, when they come back, they stay here another 2 nights. And first, they have a meeting with a Remy. There is the manager of the drivers. They do the schedule for the flights back home and that things. And then they show in the famous book about the medicines that they can purge and that things. And then we do vitals. We saw the patients. We ask about the most important for us here about medicines that they take, any allergies and that kind of things. And that's it. We explain them that they can have a shower once a day. They are more free here at the hotel.
Yeah.
We always recommend you just continue with the fluids, keep walking, and we explain them the medicines that they give it to them. And that's pretty much when they come back from to do the dressings. We do dressings, and that's pretty much. We don't have too much. How can I say? We don't see them too much. The bariatrics like
Yeah.
plastics
Yeah, because
because they
it's less
say
of a recovery, immediately. So when you say the dressings, can you guys explain to the bariatric patients what the dressings mean? Because they do have some incisions. So can you explain those incisions and what you guys do?
Yeah, for sure. They usually have 5 incisions on her belly, sometimes 4, depends on the doctor. Those incisions, we usually change it once or twice a day, depends on the patient. Because if she's leaking or he's leaking through the incisions, we change it twice or once a day. Also, those bandages, they're really important to keep it always dry. They're in case if they get blood or they're wet, we need to change it because we need to prevent all the touch of infections.
Mhm.
That's why it's very important to keep all bandages dry and clean always.
Awesome. And so do the bariatric patients have stitches that they need to remove, or how does that work?
Oh, depends. Depends on the usually it's where the drain port is, where they
Mhm.
pull the drain out. Is the one it's sometimes bleed or leak more than the other ones. Those when that drain it's bleeding a lot or something like that, they put a stitch on it. That stitch it's always come out before they go home.
Okay.
And the other ones they usually have dissolvable stitches. The ones you don't need to pull it out or nothing like that. They're good to dissolve. You need
Mhm.
to take care of those stitches.
Awesome. So they just got to make sure that their wounds are clean and dry
Mhm.
at all times. And so if they do end up with a stitch for the drain, do you guys remove that before they leave?
Yeah.
Yeah,
Awesome.
usual. The doctors they tell us when the patient comes with stitches and
Mhm.
when they not absorbable. So if we need to remove it, we remove it the day are leaving in the morning. So
Gotcha.
we do dressings and then we remove the stitches here.
Okay. And so after bariatric surgery, what's the most common side effect? Do you know how for me, I had like some pressure in my shoulder and everyone was saying it's gas pain. Do you think that that's the most common thing that you guys hear from the patients?
Yeah, always after surgery, what would tell the patients that nauseous,
Mm,
gas pain, gas pressure, it's more common after surgery
mhm,
because they put a lot of gas inside to do the surgery and everything. That's why I think it's always the hardest part. A lot of inflammation always when you drink liquids and everything, they have that problem to drink because they have a lot of inflammation, a lot of swelling.
mm.
That's why it's hard
It's
sometimes to drink. But I think nauseous and the gas pain is always the hardest part after surgery.
right. So what do you recommend they do for the gas pain?
Well, most of the time we tell them to the patients that they have to be walking,
Mhm.
because it's the most important and probably is the only thing that is gonna help us to expose the gas. So could be that the walks, and we recommend you if they have the Gasex too, they can start to take them.
Mhm.
And I think that's the two things most important that we tell them.
Awesome. And so and then the bariatric patients after, they're back at the hotel, they're feeling pretty decent apart from maybe just the odd bit of gas pain, but it is good for them to get up and get moving and get walking. So, EOC offers that tour as well. So the drivers, they'll take you out shopping to the souvenir stores. They take you out for broth and then bariatric approved sorbet ice cream. So it is really helpful for them to kind of get out and about and get moving and that starts to make them feel a bit better. But plastics patients, on the other hand, they're not allowed to move. So, so let's talk about plastic surgery. So, how is that different from beginning to end? What do you guys do for the plastics patients?
Well, plastic patients, they need more, I mean, everyone's need care,
Yep.
right? But the incisions that they have, they are more bigger.
Mm-hmm.
So we always tell them that they cannot leave the hotel or even the medical floor
Mm-hmm.
because we can have risk to infections more easier,
Yeah.
and we can have the risk to have openings while they are here. So yes, most of the patients, we know this is surgery difficult. They need to be like prepared mentally,
Mm-hmm.
and they need to be healthier and that things. But I think it's a lot of mental too because they're gonna stay almost 6 nights
Mm-hmm.
here at the hotel and be in one room, someone they are by themselves, and that things could
Yeah.
be boring. So
Yeah.
we understand that part, but it's very, very important when we tell them like that they cannot do too much, they cannot walk too much, they cannot go outside and that things. So
Exactly.
that's
So,
why.
okay, so let's talk the plastic patients. Let's talk for them there who are listening now who are coming to Mexico to have surgery. Let's explain to them what do they do. So the first day that they arrive, they check in with the EOC office, and then they immediately come see you guys, right?
Yeah. It's when we do the AKG.
Mm-hmm. And
We
you
meet
guys
the,
you guys are located in the office anyways. You guys have your own little room and you've got the machine in there, so you do the EKG for them there?
Yeah, we do the EKG here. All the patients need to have a EKG here with us
Mhm,
before surgery to make sure they don't have any heart problems.
mhm,
Okay, we always do it. The patient take that EKG with him, and always on our pre-op appointment, they show it to the doctor. We always take a copy, we scan it here just to put it on her papers and everything.
mhm.
But the original one, the patient always keeps the original one to show it to the doctor on your pre-op appointment.
Awesome. And then they go off to the hospital, for their pre-op appointment, they do their blood work, and then they do their pre-op appointment. That's done, they're all marked up, and then they come back to the hotel, and the next day is surgery day, so they go off to surgery. They're only in the hospital for one night, the plastics patients, correct?
it's just one night, and they come back the next day to us, and is when we have more time with them to explain them everything. Like bariatrics, they have their own medicines too, so
Mhm,
we explain them the medicines. We do the check-in when they come here, and the first day from after surgery from the plastics could be like boring because they just gonna be resting,
yeah,
but everything starts the next day here when they start massages, showers, dressings,
right.
and that days.
Yeah, so when you wake up that next morning in the hospital, from a patient's point of view, this is what happens. This is what happened for me. You wake up, and then the nurses at the hospital, they get you up, they get you showered, and then they get you in your garment, and then you wait for the once the shuttle arrives, the drivers will come pick you up, and they take you back to the Grand Hotel. This is where these two angels will be waiting for you in the lobby with a wheelchair, and they're greeting you, and then they show you how to use your poppy, and they put that in. You guys use all the protective padding. You get everything just
Pillows
like,
with the pads.
because you can, you leak after plastic surgery. A lot of us have had lipo, or we're cut in many places, and then you guys take us up to the room, and then that's when you tell us like about the medications and all that kind of stuff. And then, but honestly, by that time, you're exhausted as a plastic surgery patient. Just doing that, it's already been such a long day. The hardest part of your day is just showering and moving. So by then you're just kind of ready to sleep anyhow. But you guys come back, you guys check, once we checked in, you check our vitals. So you do what, the blood pressure, the temperature, the heart rate, make sure that
Yeah,
we're
in
all
case
good.
they are leaking, we change the dressings.
Yep.
And
Mhm.
we always try to explain them the first day at the hospital is different than here,
Mhm.
because at the hospital is the first time, like you say, that they are stand up, the first shower, so could be pretty rough that day.
Yeah.
But here at the hotel, they will see that every day will be better.
Yeah.
So yeah, we do vitals when they come. We do dressings, and we explain them the indications.
Mhm.
Every day we explain you the same things.
Yep.
Um, about the surgery, and every patient when they come here they have different kind of surgeries. I mean, it's plastic surgeries,
Mhm.
but some ones they have some indications, or they do some things that the other ones they cannot, so
Mhm.
we try to explain that everyone is different.
Mhm.
And that's pretty much the first day.
Yeah, right. And then the next day you mentioned about the massages. So can you explain a little bit about how that schedule works?
Yeah, the second day when they get here, we always call the first time and like the first thing in the morning. We call the patients to let know what time's going to be their first massage. Every day is different. It depends on what time the therapist gets here. But usually it's around 11 noon. Okay, we tell the patients what time the therapist will be there. After that, after we finish with the schedules and everything for massage, we start the rounds. We do the morning rounds,
Mhm.
do vitals in case of the patients are leaking or draining through their incisions. We put new bandages. We put the garment back on just to make sure the patient's always clean and dry. I
Mhm.
can tell you before with the bariatric surgeries, but plastic surgeries, the patients they need to be always have the incisions dry and clean, just prevent all the type of infections and all that stuff. But they usually have the massage around noon.
Mhm.
Yeah, we have some things about the massages, because it's very important to the patients to know the therapist starts at that time, but she have um at least with the patients. So
Mhm.
we try to give it to you a time, but usual could be 30 minutes before or 30
Mhm.
minutes after the
Yep.
time that we give it to you. So if you're gonna have a surgery with us, we recommend you just be patient, stay
Yeah.
in your room,
Mhm.
waiting for the massage. Every day you're gonna have one,
Yep.
even if it's not the time that we tell you, but it's no more than an hour after the
Yeah.
time that we give it to you.
Yeah, so that time is just a rough estimate. So to be within that hour, it could be on the hour, it could be a little bit before, it could be a bit after. So just be patient because yeah, they are, they are working with a lot of patients, and some patients need more time. Some patients, they leak more. They need a little bit more assistance. And that could be you. So you have to kind of just be very mindful of, you know, everyone's doing the best they can to the but you will get seen as, as soon as you can. But it's not like you're being neglected. It's just that someone else is in front of you in the line. So there's a bit of a line. But it all happens, but you guys make it happen very, very, very smoothly, like very seamlessly. You guys do a really, really good job at that. So after they've had their massage, I know Mary Paz says to them like to lay there just for like about 20 minutes or so before getting up. And then it's time for the shower, right? After the massage, correct?
Yeah, the shower is always once a day because, well, that takes a lot of energy
Yep.
of the patient. So always we do it 30 minutes after the massage, when they are more relaxed,
Mm-hmm.
when they feel better for stand up and that things. And the shower is every day for remove the oil that they use on your body and for prevents infections and that thing. So every day we do a shower and every day we do a dressing change.
Mm-hmm.
But obviously, if you are draining during the day, we can change it like more than one time.
Yes. So they just give you guys a call if they've leaked through some of their, dressings. You guys will come up and change them. I know you guys changed me a few times, and I'm like, I'm so sorry. I'm so sorry. And honestly, you guys, they're just the nicest, sweetest people. They're like, it's okay, don't worry about it. Like it's fine. And I'm like, I feel so bad. They're like, it's okay, we're here. And I'm like, oh, you guys are just so nice. And especially during plastic surgery, it's a very vulnerable position. If you're modest, all modesty goes out the window because I believe it or not, I started out very modest. But then, it gets to the point where you guys see us naked, and in our absolute worst condition too, because we're cut, we're bleeding, we're swollen, we're bruised, we're mental, and you guys just really just calm us down and comfort us and are just so caring. So thank you. Honestly, thank you as a patient, as a coworker, and as friends. Like you guys are so good at what you do. So round of applause for the nurses. You guys are really amazing. Um and so tell us, we have face surgeons and we have body surgeons and we have bariatric surgeons. So how many patients roughly a day do you guys see to? Could range from gosh, a lot. You guys are
Yeah, a
busy.
lot. I think never, well, at least that they have vacations together, but
Mhm.
never we have less than eight,
Mhm.
nine
Yep.
patients. Each doctor, each surgeon, they have their own like a physician doctor.
Mhm.
So you're gonna have every day one visit from the doctor.
That's good to know as
So
well. That's really cool. And the other thing is each surgeon has their own specific set of rules. So, we love that the patients get to like mix and mingle with each other and become friends, but you got to be really careful of like, oh, well, I'm not doing that because, or no, you have to do this because this is what I'm doing. You have to really just listen to your surgeon's specific rules because they do have different rules. So if you're Dr. Lazos and you're Dr. Rios or you're Dr. Nico, just listen to what the doctor says and the nurses say and the surgeons say, versus what your surgery sisters say. Because we
yeah,
all, yeah.
yeah, sorry, that happened a lot with the medicines.
Mm.
Um, some patients they have another doses of the antibiotics,
Mhm.
or some patients they like to use like the pain patch. There is super famous right now.
Yeah.
But sometimes some doctors, they don't like to use it, and
Yeah.
depends a lot of the patient too. But that happened a lot, that they tell us like, oh, but why she's taking, I don't know, 2 pills of the antibiotic
Mhm.
and just me one?
Yep.
It's because every day is different, and the
Yep.
surgeons, they work different. So
Exactly. Yeah, you guys gotta remember our bodies aren't the same as the other person you're comparing to. Procedures are different. Even if the procedures are exactly the same, you don't know um what they used on you during surgery. You know, some surgeons use different anesthetics, some surgeons use different cocktails of whatever medication they've like pain medication they might have you on during surgery, like all that kind of thing. So really, really just trust what they're saying. Because it's specifically tailored to you from your surgeon. So that's a really good point. Um, Now, with plastic surgery, what are some common complications that could arise while they're there with you guys? And what should they keep? What should they keep an eye on?
here, I think, thank God, we don't have too many complications.
Good.
But most of the day that we can saw is maybe a tiny bleeding,
Mm-hmm.
and we notice with the drain, when it change the color, when it starts to looks like more red, when the patients, they know are feeling better every day,
Mm-hmm.
they start to feel worse every day. Um, I think that kind of complications, openings, is super weird when we have openings, at
Mm-hmm.
least that the patient, they starts to do too much,
Mm-hmm.
or carry things, or move too fast and that things.
Yeah.
But it's super weird when we have openings here. And what else about?
I feel like I feel like this is just talking from experience. When I would sometimes shower, like I would get dizzy. Like I think my blood pressure would drop and I'd get lightheaded. But I know when that was coming on. So my tip is like keep orange juice around. If you can have some orange juice and have a drink of that. But some patients can pass out and then if they fall, then they split something open. Like it could get bad. So you just have to, that's why another reason why they say don't leave the medical floor as well, because you might feel fine, and then next minute you might feel dizzy, your blood pressure might drop, but your body has gone through so much trauma and it's healing. So you really, 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 as boring as it might be, you just have to take it super easy, right?
Yeah, we always try to tell them too about, we know the most of the patients that we have, they for plastics, they are bariatrics, but
Mhm.
we try to tell them to eat well,
Yep.
drink fluids. We have patients that they don't like to eat too much, or they
Yeah.
don't like to eat protein like the chicken and that stuff.
Mhm.
So we always try to tell them that the key is that eat well, drink fluids, and it starts to walk, but just the necessary. You're
Mhm.
supposed to be stand up every hour, 2 or 3 minutes, just
Okay.
for prevents blood clots, but
Yeah.
no doing a lot of laps
Yep.
during the day and that
Yeah.
thing. So
No,
yeah.
going hanging out by the pool and, stay out of the sun. All of that stuff, even including the facelift patients too, because I know with Nicole, she was like, "I don't feel any pain." Like, I feel like the facelift patients really feel like it's a lot easier, so they feel like they can do more, but same applies to them, right? They're not supposed to leave and go out and about. The only time you leave is to go to your post-op appointment, right? So when does that happen?
That the post-op appointment is usually a day before you go home.
Mhm.
Uh, a day before you go home, the doctor you go to your doctor's office to check on your incisions, do post-op pictures and post-op instructions about the surgery and everything. But usually it's a day before you go home. I think Doctor Nico is the only one to do it 2 days before you go home.
Okay.
But so it's a day before you go home. Doctor Nico 2 days before you go home, and Doctor Spino. You see Doctor Spino 3 times.
Mhm.
During the 7 days you're here with us, you see Doctor Spino 3 times. On the doctor's office.
And that, like I says before, every day the doctor of the doctor assistant of your surgery, they supposed to go to your rooms. So doesn't mean that you're gonna be alone with other doctors.
Mhm.
Just they don't have time, exactly time to come. We don't have it.
Mhm.
But they always gonna go and see your incisions, make sure that you are okay. If you have questions, they can answer it too. So just with your surgery is like a right before you go home, like a
Mhm.
couple days or one day before, and like Ricardo says, with Dr. Espino, you see them during your stay here, like a 3 times, I believe.
Right. And so the physicians that come in, obviously they are in communication with the surgeons, but you guys also have direct communication with the surgeons too. So you guys let them know if there's anything that's concerning, or just you guys let them know how everyone's doing every day too, don't you?
Yeah, that's right. We always have contact with the surgeons, the doctors, and everything. We always on contact. We send information, they send us information and everything,
Hmm.
just to make sure we're on the same page and everything with the patients.
Okay.
Yeah, and every day too, we try to take up pictures of the
Mm.
incisions,
Mhm.
um, just for make sure the evolution of the incisions that they don't look like worse than they was. And yeah, we tell them like, I mean, you're in good hands. If you have questions and we don't know the answer, we talk immediately with the doctors. Sometimes the doctors they called us like, oh, you know what, you can go with this patient. I need to talk with her, and they call you. So
Yeah.
I think you're gonna be fine these days.
Yeah, it's actually amazing because here in the States, like a lot of plastic surgery, it's done and then you go back home and you just figure it out yourself. And then you do go back for follow-up appointments to the surgeon, but you guys it's get so much more care going to Mexico doing this because you are just like you're the eyes. You're on us all the time, and you guys before you guys come in the morning, and then also at the end of the night as well. You guys come in, check the vitals again, make sure everything's good. And if at any point during the day you're not feeling good or something, you just give you guys a call, and you'll be right up to check what's going on. So that's really beautiful. So now one thing about plastic surgery is really hard to get comfortable, right? So that's probably like would you think that's the biggest complaint that we all have is just like, "I'm just uncomfortable. I can't sleep. I can't figure out." So how do you guys suggest we lay? Like, let's just say, we've had the full mummy makeover, the BBL, the boobs, the belt, all that. Like, what's the best position you suggest the patients lay in? Because I know you guys build pillow forts and all kinds of things for everybody.
Yeah, it's always depends on the patient.
Mhm.
We always tell like suggest the patients to use the bed, the medical bed, because they always you can raise your back, your knees, and everything. But it's always sitting on the poppy pillow. We tell the patients to if they want to, they can put pillows on her backs
Mhm.
just to feel more comfortable. Pillows around the arms, on their knees, always like hunch just to prevent the tension on the tummy. We sometimes patients who prefer to use they have a chair in the room, like a little couch. They can sit there
Mhm.
and always pillows behind your back, the poppy pillow sitting on the poppy just to prevent the BVL disappear.
Mhm.
And I think that's it. Like the sitting on the chair or the bed.
Mm.
Yeah, we try to make it like a feel comfortable, like you
Yeah.
say, but we need to try to keep also the position there is good for you for
Mhm.
prevents any opening, any necrosis or any when you don't have the position that your body needs after the surgery, the fluid blood could be less on your tummy.
Mm.
So yeah, that's why we always put the bed like a sitting. We put the pillow under your legs, and we tell them like when you're walking, you need to be hinged for around 2 weeks.
Yep.
When you're sitting here, your legs they need to be flexed. So it's I mean we try it. Sometimes we don't we cannot have that we cannot make the patient comfortable 100%.
Yeah.
Yeah, but I mean the next day we can saw them and they are like oh, you know what, I put this place on the couch like Ricardo says, and this works for me,
Yeah.
so this is a position that you say, but I'm in the couch, so that's good for us.
Yeah. Oh, good, good. And so for everybody out there, can you let them know, like, what is the most common combo of procedures that you see every day, pretty much? What's the most common?
Yeah, usually it's the mummy makeover, like the tummy tuck 360,
Mhm.
breast lift with implants, and lipo, BBL,
Mhm.
the Brazilian butt lift. Usually, like 80% of the patients have that one.
Yep. And these are all done in the one surgeries,
Yeah.
you guys. So there's a lot of things to think about, a lot of things that you need to, ways you need to lay and things you need to do. And so let's talk about really quick. oh, not really quick, but how important A, the faja is, and B, how do we there's a lot that goes on in changing the dressings and what needs to be covered, and can you explain, like, the compressor on the wounds and all of that? Can you explain how to get dressed after plastic surgery? Because we don't wanna leave, like, when it's time to go home, how many patients say to you guys, "Can you come home with me? Can I take you home?" 'Cause I say all the time. Even when I'm just there
Yeah.
for fun, I'm like, "Hey, do you wanna come home? You wanna come to Vegas?" But, 'cause, yeah, you guys, it's a lot. There's a lot that you need to do. So can you explain, let's just say someone's had a mummy makeover, for example, how do they get dressed? What needs to happen? From the sprays to all that.
Yeah, maybe some patients they feel or they think that we are that we are
Bad.
bad, but these days we try to make you more like a independent, because we know that when you get home, some
Yeah.
patients they are alone,
Yep.
or you're not gonna have anybody all day to do your dressings by
Mhm.
yourself. So we always try to explain you your incisions. They need to be always clean with the sprays. Usually they recommend two sprays that you can get it here, the
Mhm.
antiseptic and the other one, the Rifocina. And with the sprays, once we put the sprays after your shower, we dry them. Everything have to be really, really dry. Your belly bottom. Could be a weird sensation. We always tell them
Yeah.
like take a deep breath, because it's
Yeah.
gonna be weird.
Yeah.
But we need to clean really, really good the belly bottom and
Mhm.
dry it. And once we clean everything and it's dry, we start to cover the incisions. Here we use a stereo gauze. There is long. The name is compresa. But we always tell you that if you don't have it at home, you can use the roll of gauze, and I believe it's the most common in the
Mhm.
States.
Mhm.
And until everything is covered, you're gonna be fine. But we try to do it this way because that works for us. That
Mhm.
keep the patients dry. They feel comfortable. They don't feel like too tight
Mhm.
um, when we use that kind of band-aid. And once we cover the incisions, we put your faja on. You have to have it every day, all day. Just you take them out for the massage and for the showers.
Mhm.
But how much you use it is gonna help you more. If you take him off the faja, sorry, for a couple hours, you're gonna notice that you're gonna be more swollen.
Swollen.
So some patients at the first they don't like, but
Yeah.
then they love it. So
Yeah, exactly. Now you're like, "I don't wanna go without my faja."
yeah.
So you know how the wounds have to be covered up? How long do we have to keep once we get home, like, how long do we have to keep those wounds covered for before we put the faja on?
Usually it's around 3 weeks after surgery. This
Mhm.
depends until your scabs are out.
Mhm.
When your scabs are out, you don't need to like cover your incisions anymore. Usually it's 3 weeks after surgery, 2 weeks after you get home, but it's usually until the scabs are out.
Mhm.
Maybe less, maybe more.
Yeah, some spots they gonna heal more fast,
Mhm.
and some scabs they gonna fall more fast than the other parts. So until you keep covering the incisions when they have the scab, that's gonna help us to prevent bigger scars.
Mhm.
And if they are leaking, you can still cover it, but normally it's that time.
Gotcha. And then after the scabs, they take we don't have to use the compressor or the gauze anymore, but you still have to wear your faja. Yeah,
Yeah,
for
with the paja is 2 months.
2 months.
Well, like the time that they recommend to use it, two
Mhm.
months. But we have patients that they come back at the second round and they have, I don't know, like 6 or 8 months, and
Mhm.
they is still in the faja because they
Yeah.
say that they feel more safe.
Yeah.
So
Mhm.
yeah, depends a lot of the patients.
Yeah, it kind of becomes like your second skin, and also because, like, after plastic surgery, you swell even after you've healed, like, you can swell, like, for a year and after, or even when it gets hot, you feel your body swelling and you're like, "Ooh." And also, you know what I think it is too? Like, because most of us who have had plastic surgery, we've been overweight, right? And so even when we've lost the weight, we've still had the skin. So you don't notice, A, if you bloat, because we've never had flat stomachs. So you don't notice if you bloated, and you never notice if you're swollen because it just,
Uh-huh.
because
It's a new body.
yeah. So now you got this new body and everything is tight. you absolutely feel when you do swell, and you do feel if you bloated, and you're like, "Oh my goodness." So, yeah, the faja is your best friend. It takes a while to wean off that thing, but some people want it off right away. They're like, "I need out of this." So it's, it is what it is, but as long as you're in it for, I think what they say, like a minimum 6 weeks all day long, and then I think you can go to, like, just sleeping in it at night, or something like that if you wanna kind of, wean yourself off it. Alright, you guys, so do you have any tips for anyone coming to Mexico for surgery? So whether it be plastic surgery or bariatric surgery, any tips for anyone coming?
Just try to be prepared for this journey.
Yep,
It's really good. We always glad to see new patients here. But I think just we prepare. It's a long process, but you can handle it.
it's worth it. Is it, you
Yeah.
guys, how cool is it? Do you recognize, well, you probably don't recognize them because 'cause they've lost weight, but we have a lot of patients that come for bariatric surgery, and then, like, a year or 2 later, they come back and they're skinny and they're coming for plastic surgery. Like, do you remember some of those people from when they had their bariatrics?
Yeah,
Sometimes.
yeah,
Yeah.
sometimes it's we see a lot of patients every day.
Yeah.
Sometimes it's like hard. A lot of patients like I think I remember you from last time or something
Yeah.
like that. We see a lot of patients every day. But sometimes like we remember a lot of faces here.
Yeah.
Yeah, I think it's more easier when they have plastic already and
Mhm.
they come back for second round.
Right.
I think we recognize them like right away, like oh, I saw you before, or the name sometimes too.
Gotcha. Yeah, because you spend a lot more
Yes,
time with the plastics patients, and,
yeah.
you're dressing them and doing all that stuff. So, yeah, when they come back for round 2 and 3, and then they come back for face, and, like, we do have a lot of repeat people, huh? Isn't it? It's kinda cool though, but everyone loves you guys. You guys do such an incredible job. So thank you on behalf of, all the patients and everyone here at ESC. You guys are the best. Is there anything else you want to say to anybody watching that's gearing up to come to Mexico?
No, I think just be prepared. You're gonna be fine here. Mexico is safe with us,
Yeah.
and that's it. I think we expect you here.
Yeah, we're waiting for all the patients here.
Can you
We
can you guys
open
give us like, let's just say, like, what's 3 words in Spanish that you would recommend people learning? Because everyone speaks English that they're gonna encounter at, you guys all speak English, but, like, I don't know, I always love to, like, say, when you guys come in, like, "Hola," or, like, practice my best Spanish, like, "Gracias." So what are some, like, fun little words that people can learn before they come?
I think the unused words and everything can be like the pain level. Sometimes it's like estoy bien,
What does that
cero
mean?
dolor. Like my pain is good, zero pain on it,
Okay, okay.
something like that. Or also like if they already have lunch or breakfast, like I'm like yeah, desayuné. That can be like a good thing too.
Okay.
Like there's a lot of things because we talk about like we have a lot of patients that like tell me like
Do
teach
they?
me words on Spanish.
Right,
Uh-huh.
right.
Yeah, and we always try to do like the
Y
easiest works.
You guys are the best, and I know when you always come in my room, like, I'll say, "Hey, like, where can I get some good chicken around here?" Like, guys always give, like, good recommendations of, like, where the restaurants are, because you can, Uber Eats anything to the hotel. So, you guys always give the good recommendations of, like, food. So where would be, like, the top places that people you think can order from for food when they get there?
Uh, Remember, we always tell the patients to eat here like healthy.
Mhm.
Like the more healthy that you eat, the less swelling that you're going to have, and everything. Wherever you like, maybe the 80% of the patients have like the tummy tusk, and it's really tight. If you eat something like not that
Big.
healthy, you're
Mm.
going to have a lot of pressure and everything. But we always tell the patients the more healthy that you eat, it will be better for you. Try to prevent salt things
Yeah.
because the salt it will
Yeah. But we know too that the patients, when they come, they want tacos, they want birria, they want burritos
Yeah.
and that thing. So we try to tell them like how, okay, I mean, if you do it one time, that's okay, right?
Yeah.
But I mean, please before you go home, at least plastics. I mean, no
Yeah.
bariatrics,
No, yeah.
but plastic. Some of the plastic, they always try tacos. They
Right.
always try tacos.
Yep. And so at the EOC office, Michael, his mum makes burritos and they sell out immediately of a morning. So but the patients can get, if they want some like cool burritos, they can get them from the EOC office anyhow. I know Nicole, you guys know Nicole. See, look, they're laughing.
She always was here like at 7 a.m. Like, is any burritos there? Is any burritos there?
She sure does. She'll ring down, "Hey," or even, like, the night before, "Hey, can you save me 7 breakfast burritos?" Like, it's never, like, 1. She wants a whole lot. I'm like, "And she's this skinny, it's not even fair."
Yeah, when sometimes she called and I was like, oh, how is Kayla? Oh, she's good, but you have any burritos?
All the time. All the time. Or the phone will ring and I'll be like, "Oh, maybe they're telling me my time for my massage," and it'll be either, like, you guys or Erica or someone at the desk, "Hey, tell Nicole we got burritos." It's a real thing, it's an addiction, it's a problem. You guys, I'm gonna be there on the 9th, so in, like, 2 weeks, I'm coming back with Nicole, so have the burritos ready, and I'm coming back with my other sister. We have a middle sister, and she's coming for bariatric surgery, so I can't wait for her to meet you guys. She's gonna love you guys, but yeah, if there's anything you need from Vegas, you let me know because we're heading back soon. So I'll see you guys soon. Thank you so much for being on this episode. And yeah, you guys take a look at these beautiful faces because they're going to be the ones helping you post surgery recovery, the EOC nurses. Thank you guys.
Bye bye.
Bye.
See you soon.
Yeah, see you soon. Can't wait.